Hi, I'm Brittany with Beautifully Connected. I'm a birth doula, massage therapist, and I practice herbals with the Wise Woman method. Welcome to my channel. Hey there! Today we're going to talk about how to tape your abdominals for stability and support during pregnancy. So what you're going to do is you can do this to yourself or you can do this for clients. If you're doing this to your client, you're going to have them lay on the table on their back. Now, if they are quite advanced in their pregnancy, you want to remember to keep them comfortable. So maybe use a pillow at their head for a little bit of extra support and a pillow under their knees to take pressure off their lower back. And then laying back when you tape the abdominals is the best way really to do this because your skin will stretch a little bit when you step up and it might sag downwards. So if you tape somebody while they're laying on their back, the skin is in a nice back, like neutral position, and you can get a good feel for how you should tape. The way that I tape, what I found is best, I think less is more, especially when we're talking about pregnant ladies, because the skin on the tummy can get a little bit thin, and due to so many hormonal changes, the skin can even get a little bit irritated. So I don't want to put a bunch of tape, but if taping is necessary, I like to just put a small X above the belly button and a small X under the belly button, and this provides enough support for the abdominals. This is really good if your client has diastasis recti. It can help prevent spreading, and it can also help if you're just generally sore with your abs during pregnancy because it can put a lot of pressure on them. I don't tape people after 34 weeks of pregnancy. I like to either tape the round ligament or I like to tape the lower back, or sometimes both. The reason for this is because there's not been any studies done on abdominal taping for pregnancy for women. So I feel like around 34 weeks, baby's positioning starts to become very important, and you want baby to be able to get in a good position for labor. So I don't know if taping the abs is going to prevent baby from moving the way that baby needs to be born. I don't know that it is a hindrance. I don't know that it helps. So ask somebody smarter than me, your doctor, your chiropractor, your midwife. If they give you the okay, you can continue to use the tape for support, but that is just something that I use with my practice, a kind of a little warning. Thanks for watching. Make sure you hit the subscribe button if you like this video. Also, if you have any questions about holistic health, be sure to put those in the comments for me.